Diagnosis by visceral organs. We discuss heart illnesses. Diagnosis by the visceral organs is a technique for assessing an illness on the basis of the physiological functions and pathological changes of the visceral organs. Careful symptom analysis produces the pattern of symptoms, which is called the syndrome, which enables the physician to infer the pathological processes and the location and nature of the illness for appropriate treatment, and to assess the relative rise and fall of genuine and evil qi. Accurate diagnosis of the visceral organs affected and the nature of the illnesses enable the physician to aim treatment with precision. Diagnosis by the visceral organs has an intimate link to diagnosis by the 8 fundamentals and to diagnosis by qi and blood. Furthermore, it is the foundation for diagnosis by the 6 meridians, diagnosis by the 4 phases, and diagnosis by Sanjiao. Though the last 3 techniques are designed principally with exogenous illnesses in mind, the underlying pathological processes of exogenous illnesses are those of the Zhangfu organs, qi and blood, and yin-yang. Thus, diagnosis by the visceral organs may be regarded as the basic diagnostic technique in Chinese medicine and the foundation for all clinical diagnostic techniques. Diagnosis by the visceral organs is principally centered on the 5 Zhang organs. The main symptoms of illnesses of the heart relate to the heart itself, the blood channels, and the mind. So let's start with deficiency of heart qi. There are several syndromes that arise because of impairment of the heart's functions caused by deficiency of heart qi. Deficiency of heart qi is mostly due to decline of organ qi, the functions, in the elderly, inadequate prenatal endowment, or damage by prolonged illness or sudden severe illness. When heart qi is inadequate, the heartbeat is weak and blood circulation becomes sluggish. As a result, the heart and the entire body lose nourishment, and this can lead to reduction in the functional activity of the heart and all the organ systems in the body. The typical syndrome of heart qi deficiency is as follows. There are palpitation of the heart, shortness of breath, and chest tightness that are aggravated by physical exertion, a pallid complexion, weariness with weakness, and spontaneous sweating. The tongue is pale with a white coating. The pulse is depletive or hesitant and intermittent. Then we talk about deficiency of Heart Yang. When Heart Yang is deficient, it fails in its action of bringing warmth to the body. Heart Yang deficiency usually progresses from deficiency of Heart Qi. Because of deficiency of Heart Yang, the blood channels lose their warmth, and the cold evil is able to congeal blood, causing stasis. This in turn aggravates Heart Qi deficiency. Because of the loss of the warming action of Yang, syndrome of deficiency cold appears. In deficiency of Heart Yang, there are symptoms of Heart Qi deficiency. In addition, the typical syndrome includes the following. There are cold aversion, cold limbs, heart pain, pallor of the complexion, and cyanosis of the lips. The tongue is pale and plump and may have petechiae. The tongue coating is white and smooth. The pulse is indistinct and thread-like or hesitant and intermittent. Thank you for your attention.